So today I would like to talk about an important health issues facing Aboriginal communities, especially Aboriginal women in Victoria. The health issues being addressed here is low birth weight, defined as baby born weighing less than 2,500 grams. Low birth weight is a significant risk factor for developmental delays, higher rates of stillbirth, and linked to long-term health issues. According to Australian Institute of Health and Welfare 2024, Aboriginal women in Victoria face much higher risk of having low birth weight babies. For example, in 2020, 9.6% of Aboriginal singleton babies weigh less than 2,500 grams at birth, compared to just 4.7% of non Aboriginal women. Among Aboriginal babies born preterm before 37 weeks, 58% had low birth weight. The rate of low birth weight is higher in remote areas, 13.1% in very remote regions compared to 8.3% in mature cities. 41.3% smoke during pregnancy compared to just 7.5% of non Aboriginal women. So why is this issues important to target? Because behind these numbers are real families and real futures. Reduce the rate of low birth weight means reducing infant death, improving children long-term health, and closing the health gap between Indigenous and non-Indigenous women. Moreover, access to mainstream health services is difficult due to cultural barriers, geographic distance, and a lack of trust in the conventional health system. This makes them do not want to seek early medical care, leading to serious risks during pregnancy and childbirth. Therefore, it is essential to develop a culturally safe maternity care model that is appropriate to the needs and traditions of Aboriginal women. And this is why the Curie Maternity Service was created to close the health gap, support safe pregnancies, and improve the quality of life for both mother and babies in the First Nations communities.
Hi, I'm Radhika. I'm going to talk on historical and social context of low birth weight in Aboriginal babies today. There are lots of contributing factors in this, like historical and intergenerational trauma, colonial and post colonial health inequities, systemic racism and protective isolation, adverse social determinants like poverty and malnutrition, cultural barriers to trust mainstream health professional so if they don't go for their antenatal checkups in pregnancy, cycle of late intervention and trauma. So low birth weight is not just a medical issue, it reflects deeper historical injustice and social inequity. To address it effectively, we should tackle broader social determinants of health in Aboriginal communities. That will help us to work on closing the gap. All right. Now, let's talk about this image here. The image shows how the effect of intergenerational trauma and stress across the generations from pregnancy to adulthood of a person that leads to poor health outcomes like low birth weight in Aboriginal babies. Determinants includes poverty, family violence, substance misuse, and childhood trauma that causes ongoing stress and health issues that passes down to the generation, which becomes a cycle of intergenerational trauma in Aboriginal families. Thank you.
So this is the culturally appropriate resources addressed to health topic. So it focuses on the supporting the community to increase the healthy pregnancies and positive early parenting of the Aboriginal peoples. So according to the VAC Center of Excellence for Aboriginal Families Wellbeing and Health, the program have to support the holistic health and well-being of the Aboriginal peoples. Additionally, it promotes the early year of parenting. So it delivers the service based on the parental education, health and well-being, healthy from trauma. So to make sure that the program run effective, inclusive, and respectful. Otherwise, the VA system should always support them to improve in health and healing from trauma, teaching them parental skill, and the program make the communities healthy and safety life. So besides the program support the community led and maintain self-determination. So correct the communications to have the positive change on their own goals and strengths, and the program guide them to make choice by themselves. Operational, they actually have the right choice decision. So besides, they are the Korean maternity service in Victorian. So it had to reduce low birth weight and continue of care and reduce smoking during pregnancies. So and this source can be a cultural approach because they basically for the Aboriginal women and they reduce racism, enhance trust and support the Aboriginal women's access to healthcare, provide knowledge and scale the parenting pregnancies and reduce low birth weight and smoking.
We are familiar with the fact that community controlled healthcare is more likely to be accessed by Indigenous persons. The Koori Maternity Service Program is an Aboriginal led organisation that is delivered with the use of midwives, Aboriginal health workers, and Aboriginal licence officers. This can be positive when assisting a postpartum Indigenous mother, as all three of these resources can target diverse concerns from both a general and cultural background. The presence of an Aboriginal health worker can be beneficial in translating needs to the midwives and healthcare professionals and help them understand the various health concerns within the Indigenous community. The assistance of a community control organisation can increase the likeliness of Indigenous mothers cooperating with healthcare professionals throughout pregnancies and lessening the chances of facing low weight births, as the attendance of someone who shares and understands the same culture can create a more welcoming and approachable environment. The utilization of holistic care is extremely crucial when assisting a postpartum Indigenous mother with a child struggling with low birth weight. The attendance of family and elders during the process of pregnancy and childbirth can ease an Indigenous mother's concerns and fears, as it provides comfort and reliability on those who share the same experiences. The display of community during childbirth has been demonstrated, as women from the Indigenous community will be present during childbirth, as it was seen as a woman's business, therefore proving to be beneficial as they could provide cultural support. The Koori Maternity Services values these holistic practices by creating culturally safe birthing plans that involve family, which therefore fosters community and family connection and encouraging ancient Aboriginal practices. The inclusion of Indigenous ceremonies can help ease mothers' concerns and provide connection. A ceremony that is practiced within the Aboriginal community is the smoking ceremony. The ceremony is performed to aid in babies' health and heal Indigenous mothers by providing strength to confidently face motherhood. The ceremony includes a cultural midwife taking the mother and child into the bush away from the men and preparing a fire pit that has grass that is taken from the water. The cultural midwife warms her hands from the fire pit and massages the baby so that the warmth of the heat can give the child strength and flexibility. The child is then handed back to the mother and given breast milk for the first time. Smoking ceremonies provide a boost of confidence and assurance to Indigenous mothers with low birth weight babies, as these practices solidifies the importance of both Indigenous mothers and babies' health. When we witness statistics such as First Nations women being 3 times more likely to die in childbirth than other Australian women, it is pivotal that we focus on how to prioritise Indigenous maternity. A great stepping stone is staffing Indigenous Australian midwives and nurses. First Nation nurses and midwives represent 1.1% of the workforce. This number is evidently low and proves to be culturally unsafe, as many Indigenous women report negative experiences when accessing maternity care. The presence of Indigenous midwives and nurses strengthens cultural safety and provides trust in maternity services, and therefore the lack of them within maternity care is assisting in the issue of Aboriginal women facing lack of trauma-informed care. Experiencing negative maternity aid results in Indigenous mothers hesitating to access medical resources post-birth when facing health-related concerns towards themselves and their newborn. For example, Indigenous mothers with low birth weight babies delaying assistance, as their previous negative experiences provides nervousness and unwillingness to cooperate with healthcare professionals. The exclusion of trauma informed care and inclusion of a one size fits all adoption when assisting Indigenous mothers fails to acknowledge intergenerational trauma, language barriers, and cultural needs and practices. This approach is inconsiderate of cultural experiences and ongoing effects of historical trauma, therefore proving to be culturally unsafe. This issue can be battled by educating hospital staff about Indigenous culture, health concerns, intergenerational trauma, and encourage traditional health practices. Furthermore, a positive childbirth experience allows Indigenous mothers to willingly access and seek medical advice when facing health difficulties regarding themselves or the baby postpartum.
Koori maternity services have shown considerable success since being established in 2000, growing from 8 sites across Victoria to 14, including 3 that are situated within public hospitals. This expansion reflects the growing demand for and trust in culturally safe care. Koori maternity services operate using holistic health ideals and offer flexible service delivery, such as completing home visits using dedicated vehicles in order to make care more accessible, particularly for Indigenous women and their families who are uncomfortable with hospitals due to past personal trauma or systemic discrimination. The services approach, offering continuity of care, employing Aboriginal and Torres Strait Islander midwives and health workers, and building strong relationships with clients, empowers Indigenous Australian women and their families, and ensures better clinical experiences and therefore better health outcomes for their mothers and their babies. These services are not only growing in their reach, they're also improving Aboriginal health outcomes Annual reports and data are submitted to the Department of Health and Human Services to ensure rigorous monitoring of service delivery and their results. So accountability helps to highlight health improvements, supporting goals such as higher birth weight in infants, fewer preterm births, and lower perinatal mortality. So outcomes also show progress towards key goals of the service, with more Aboriginal women also accessing antenatal care in the first trimester, contributing to better birth outcomes. So the proportion of Aboriginal women attending their first antenatal visit before 14 weeks rose to 66% in 2020, up from 53% in 2010. So the decline rate of preterm births and significant improvement of perinatal mortality rates for Aboriginal infants indicate that programs that, like career maternity services, are showing success in lessening the number of infants born at a lower weight.